despite some of the challenges around flooding and perhaps affordability.
Well, housing is also a big challenge for us. We also have very large informal settler communities, not as large as Cape Town's, but on a smaller scale, we do have that problem as well. And one of the things that we had to take into consideration when doing this project was, we have to keep the people safe. That's the number one thing. We're very careful in how we do projects because a lot of the people in Pasig City actually live very near the river. And that's also precisely the reason why river walls were put up. So we're not just going to tear down the walls. We're not going to if we relocate them, it's going to be impossible. So we have to figure out ways to upgrade communities, without upheaving everything, as well as making it more livable for people. So actually this project, the primary objective is really to increase the level of livability in the city by creating more open spaces where kids can play, where the elderly can just hang out, which currently they don't have.
And Mayor Hill-Lewis, in Cape Town, housing costs have risen by 38% in the last 6 years. According to a report released by the city last year, 70% of Cape Town's housing stock is being used by short-term rentals and houses. But you've said in the past that banning companies like Airbnb, it doesn't work for your city because of the tourism revenue they bring in. So what solutions are you looking at to address the broader housing issues faced by Cape Town?
Yeah, so Cape Town, like most cities in the global south, I have no doubt it's the same in your city, Mayor, is often a story of two cities side by side. I sometimes say Cape Town is half Munich, half Mumbai, because we have this really well developed, really quite wealthy part of the city where there's a very healthy housing market, very desirable places to live along the coast and around the mountains, and it's absolutely beautiful. And that's the area of the city, by the way, where there's so much tourist accommodation, right on the coastline. And then you've got this city where 1 million people plus are living in informality. So we've got, in a sense, two opposite housing challenges. On the one, you've got young professionals who are trying to live in that formalized and established part of the city where housing costs are rising sharply because Cape Town is a desirable place to live, and its tourism economy is absolutely booming. And on the other side, we've got this huge number of people who can't afford any housing at all. And we need to deliver fully subsidized housing, basically state-provided housing. And then we have the thing that underlies it all, and this is why we can't think of simplistic solutions around short-term rentals and so on. The biggest thing is unemployment. So the one part of our economy that is booming and providing so many new jobs is tourism. We've got so many tourists, and I'm very grateful so many more American tourists. American tourism has grown by more than 40% over the last couple of years, owing to those new flight connections. So we're so grateful for that. And now 220,000 people in the city work in the tourism economy. It's a massive job provider. So there's no way that we can talk about kind of shutting down the tourism economy or doing anything to impinge its growth. What we need actually is to talk about how do we double it again, because I want 450,000 people working in the tourism economy, not just 220,000. So ideally in Cape Town's future, we'll have many more tourists, hopefully many more of them from the States. We'll have many more tourism jobs, and then people will be able to afford more housing.
But do you worry that the increased tourism will also drive up costs for residents? So how are you balancing the two?
We're undoubtedly we're seeing that happen. That's exactly what we're seeing happen. The most desirable neighborhoods, the tourist visitor neighborhoods, the housing costs are skyrocketing. And so what we have tried to do is focus on the only sustainable way to stabilize housing costs. And that is to make it easier to build things in the city. Yes, Cape Town has a beautiful natural heritage. We can't interfere with that. But it also should not be taking 2 or 3 years to get a permit to build anything. and that's what's happening. We also do have a program. I was interested to hear Mayor McLean saying the same thing about releasing city land. So we do have some old, large parking lots in the city, some unused land in those desirable neighborhoods that we are releasing for affordable housing, strictly for affordable housing. And some of those projects are coming to construction right now, which is encouraging to see. In total, there are a couple thousand units, which sounds like a lot, but in the scale of a city of 5 million, the only sustainable thing we can do is make it much easier for the large scale providers of new housing stock to do so more cheaply and quickly.
We're sharing our conversation with three of the winners of the Bloomberg Philanthropies Mayor's Challenge. We sat down at the City Lab Summit in Madrid last month. We spoke to Vico Soto, mayor of Pasig in the Philippines, Lauren McLean, mayor of Boise, Idaho, and Jordan Hill Lewis, the mayor of Cape Town, South Africa. Still to come, how do mayors hope to see their projects last beyond their terms? And what cooperation will they have with state and national governments to see their ideas through? I'm Jen White. This is 1A.
Good morning, everybody. Thank you for taking a little time here. I just came from upstairs in the reception room with the parents, Annunciation parents, and folks who are here. There's still work to be done. Obviously, that's an issue that's still in progress around gun safety. But to kind of update you on what I have said, I think is some of the finest legislative work building on last year in a absolutely evenly divided legislature in the House and one vote in the Senate. But what we've done for 8 years is we've passed fiscally responsible budgets that improve the quality of life for Minnesotans, and we were able to do that and come to an agreement. And there's a lot of work happening right now, but I'm just incredibly proud how we were able to continue to make the investments we know we need to make, whether it's roads and bridges, education, Hennepin County Medical Center, that critical level 1 trauma center, dealing with the HR 1 bill that came out of Congress that threw so much chaos into how we deal with Medicaid, food stamps, and other things, able to get that done, and then to deal with some of the issues that have been out there that we needed to get done, giving the tools necessary to fight fraud. I'm really grateful for that. Both from a centralized IG, but I would argue from an operational perspective, something we needed, the ability to stop payments on people we know are committing fraud, and that's something we fought very hard for, which we will soon have those tools. And I would just say that in a backdrop against a very chaotic and very dysfunctional federal government that runs massive trillion-dollar deficits and goes into shutdowns and deals with things that aren't important, this group of bipartisan legislators sat down cordially with collegiality and fiercely debated our positions and came to compromises around things that will do the things we know need to be done and also adjust to the moment, whether it's Hennepin County Medical Center that came on the horizon here, or whether it's trying to reduce the cost of living for people that the President of the United States says he doesn't give a single thought to Minnesotans' finances. I think about it every single day. And I would argue those legislators think about it too, and it's why we made some reductions. Look, I fought hard and believe that we need to continue and invest in infrastructure, but a pause on tab fees to give Minnesotans a little relief is the right thing to do right now, and that is a bipartisan agreement around that. I'm going to give a huge shout out to the team that made this happen. I think this deal was willed into existence by Patrick Tanis, who's serving as my chief of staff, who proved to be incredibly talented in some of the toughest moments. Commissioners Campbell and Marquardt, who are the experts here, Anna Mingy, who's our budget director, and just so many of the staff on the Republican and the Democratic side who sat in those rooms and pounded these things out. The work's being done now, and this is the point where the leaders had to make decisions, and now they have to go back to very unhappy legislators and tell them what was agreed upon. And then you got to bring those things over the finish line. So there's more work to be done. That's where they're at. These will go around the clock until Monday morning. But the good news is that this is, again, a fiscally responsible budget that reduces the long-term over-the-horizon structural deficit by 12.5%, which once again puts Minnesota, if not the top, one of the top most fiscally sound states in the country, while states like Missouri and Washington State are under threat of losing their AAA bond rating. The decisions that were made here will strengthen us again to be in a position that historic budget reserves, long-term fiscal stability, surpluses on the bottom line, and investments and protections of those programs that matter. So this is I'm really proud of this one. While not being a budget year, this was hard, and I think in the political environment we're in, the idea of getting a deal and getting a deal on time and getting a deal that all sides are proud of and that Minnesotans are going to see benefit from, Minnesota's working back towards that, the state that works motto, and for 8 years we've been able to do that. I'll take a few questions, and the specifics are here with the budget number experts.
Governor, you mentioned affordability. License tag fees are deeply unpopular in Minnesota. Should the next legislature and governor consider reducing those fees more permanently?
No, you know what's more unpopular are gas prices, the war in Iran, tariffs that caused much of this to happen. I'll say it again, Tom. We have the 4th highest amount of roads in the country. California, Texas, Illinois, and us. We have the lowest population, clearly, of most of those states, and so we make investments in that. Tab fees are up, too, because the cost of cars have gone up ridiculously high because we're living in a Trump economy that makes everything more expensive. So you got to fix the roads, and there are a few things that are more clearly dedicated than tab fees directly to public safety, the State Patrol, the Trunk Highway Fund. And so I will acknowledge this, that right now, that's one thing that we can save money on, because I'll say it again, the Trump administration is doing absolutely nothing to make life more affordable. So I was more than willing to look at this, but I worked really hard for dedicated funding around roads. We've made historic bonding bills and bonding investments, and our infrastructure is as strong as it's ever been. You can't come here, pretend like you're not going to pay for something, and then expect the roads, the bridges, the water treatment plants to be fixed. So I am not encouraging, but it will not be my decision to make. But I am more than willing to meet folks halfway on that, at which we did, reducing those prices by half for folks. But
is it difficult to reach that agreement, or is there a lot of reluctance among some?
Well, the reluctance probably was just how we would structure it for the short term. But no, I think there's an agreement. And look, if you're a Republican legislator and you're looking towards November, you're in big trouble on the cost of things, because you were promised in 24 that it was the cost of eggs, it was the cost of gas, it was all those things. Those have all skyrocketed. So they were looking to reduce these, and I agree with them on this. This makes sense. I don't want to raise those fees just to make the cost more expensive for people, but it has to pay for the roads. And I saw in today's paper, and this is a fair one, how do you deal with EVs who aren't buying gas, but they're still using the roads and the wear and tear on that? So I think this was a smart one, that I do not deny people are feeling those. I do not deny when the average cost of an automobile has exceeded $50,000 now. That's going to be an impact when you go and license your car. Those are going to go up based on the value of the car. So I think it was a smart thing to reduce them, but I would be very cautious about undermining investments in infrastructure in the future, because you have to keep it up.
Governor, what about the moms demand action that you just
Yeah.
upstairs? What did you tell them, and did it come up that you couldn't get gun control in the final?
Well, we've moved things since we've been here. I'm very proud with our red flag law legislation. I'm very proud of some of the things we've done around extreme background checks. There's more things in the package we put forward. Very proud of the senators who took a vote. It's what your job is. It's what people were told, and they were told there would be a vote. I think the expectation of those moms is that they have the vote. And I've said this all along. If you're going to vote no, and you believe this idea of these assault weapons and high-capacity magazines, you absolutely believe with all your being that that is a right that can never be infringed upon in any way, you should proudly then vote no against this, and you should be proud to stand up. It makes me wonder, why don't you want to vote on this? And I think we all know if this bill comes to the House floor, it will pass. That's clearly why it's not coming to the House floor. Because if you're against it, you would want to highlight you're against it. And so I think what those moms up there are saying is they're being very respectful in this. They disagree strongly. They're not up there chastising or questioning someone other than they were promised a vote and they'd like a vote. And I still think that that should happen. I do believe, and I am pretty good at whip counting, it will pass if it comes to the House floor, and Minnesota will take a stand on reducing violence and protecting our children. Good. Pardon me? I'll let the experts come in.
Sure. Erin Campbell, I'm the commissioner at MMB. So what we have in the agreement is $200 million, $205 million that would go to HCMC more or less immediately. There's also $500 million in a secondary reserve that would be available to them next summer. The reason for that is because the legislature is committed to taking action on HCMC and perhaps other hospital instability issues next legislative session, and so the goal would be for that action to have and the need for the reserve to go away, but if it doesn't, the reserve is available to next summer. From the reserve, for the secondary reserve, from the available balance on the bottom line.
Is the $500 million just for HCMC, or is that for hospitals to access?
It is available for hospitals that are in distress. The legislature is working on language for that.
So there's no, is there an increase in the
There is not.
And on this one, I'd like to note, too, on this work that was done, this incredible, with an understanding that this is a broader issue, trying to craft the state budget in the midst of the most dysfunctional federal situation against the retribution that now California is feeling today with an arbitrary $1.3 billion pulled from their budget, and Governor Newsom will have to deal with that this was a responsible take. But I want to be very clear. The President of the United States said in 2015 that fixing health care would be the easiest thing possible. He'd do it on day one. There's a responsibility for all of you to hold them accountable. What has the federal government done to reduce the cost of health care? And the answer is absolutely zero, other than throwing people off. So I want people to know our working on HCMC is because the absolute need of this level 1 polytrauma center and the critical state asset that it is. But I understand whether it's a hospital in Duluth or in Fergus Falls or St. Paul, all of those are under threat. We need federal partners who actually do think about individuals' finances, individuals' health care to fix this. I'm proud of what we did, but I want to be very cautious on this. This is only the beginning of the health and the hospital crisis across the country. If the federal government doesn't reverse what they did in H.R. 1, if they don't reverse their retribution that they brought on to us.
Governor, which pieces of this deal did you negotiate on this for?
Pardon me?
I said, which pieces of this deal did you negotiate on this for?
Well, I think the question was, which ones did we negotiate the hardest for? Look, my principles on this started out as they have every single one. We need to deliver to improve quality of life for Minnesotans while keeping costs as low as possible, but you have to do it in a fiscally responsible manner. And look, I'm gonna try and make the case, and I think I've got the data to support it, against a backdrop of criminals taking advantage of Minnesota. There's the broader issue of the budget and fiscal discipline and fiscal responsibility and fiscal stability, which we have done an incredible job of, and the rating agencies will probably say one of the best states in the country for that. So I have to tell you, whether you're a Democrat or Republican, when you're a legislator, you're asking for spending. They got so tired of me and our team, and Patrick Tanis said, yeah, but what's the pay for? Yeah, but what's the pay for? Yeah, but what's the pay for? You can't do tax cuts unless you pay for them. You can't give money to schools unless you pay for them. You can't build a new bridge unless you pay for them. And I think for me that I'm proud of what we were able to accomplish together, but it's inside a framework of a 12.5% reduction on top of last year's reduction in the long-term structural deficit. So when you heard Commissioner Campbell quite casually say we were able to take it off the bottom line, the reason we were able to take it off the bottom line is we still have a roughly $3.5 billion surplus at the end, in addition to the reserves that are historic, and we left money in on 28-29. Because for me, what I'm most proud of in asking is my job is to hand this off to the next governor, whoever the people of Minnesota choose, to hand off a state that is in solid financial shape, that now has the tools and the changes that were made for the program integrity around the weaknesses that were exploited by people, and yet be able to see those rankings on childhood poverty being some of the lowest in the country, health care access being some of the highest. So I think for me, I like all the proposals that were there, but I was, and my team was in the room on the fiscal responsibility piece of saying we have to stay within our means. I'm going to go here.
Governor,
Yeah, those are still being, the question was about Metro Surge. Look, to get to the leaders framework and to give target numbers and then to go work on them, we have to shrink that down to the point of the fiscal priorities that were there. And that was HR1 compliance, HCMC, reduction of long-term structural imbalance, and then figuring out could we do that in a bonding bill that needed to be done. There are a lot of policy things that are still being discussed that are still out there. And it could be things like Roy Wilkins Arena and things that need to be done. These proposals were brought up by Mayor Herr. There are things like guns that still need to be done. And for many of us, an accountability and the money that we want to put in for what happened with Metro Surge. Now, I'll tell you, one of the most frustrating things for me is whether it's SNAP, whether it's small business assistance, all of that, we are paying hundreds of millions of dollars for the recklessness of the federal government. And my team and others are working on this. They owe us. They owe us the money that belongs to us. They owe us for what they did to us. And we need to figure out, when I keep seeing the president's in a lawsuit to sue the IRS or something so that he can get billions of dollars that he was illegally. He needs to quit worrying about himself and worry about the people that he was elected to serve. And here in Minnesota, we can't backfill all the damage. And I still keep saying, you're seeing it spread across the country, that damage is going to continue to come. So that work is still ongoing. Do I think that the Republicans are going to help us around Metro Surge? I'm not real hopeful, but I know their constituents were hurt by it, so we'll see. Got time for one more?
Governor, can you speak to what you had to do to respond to HR1 and how much the state had to kick in and kind of how people will be still potentially affected?
Yeah.
Sure. Good morning. I'm Anna Miggy, State Budget Director with MMB. So the question was, what does the budget include to respond to HR1, the federal reconciliation bill that was enacted last summer? I think there are sort of three main sort of streams of work. First, Medicaid compliance, then SNAP, and then also things on tax conformity, which Commissioner Marquardt is here as well. On Medicaid, the big pieces that we needed to grapple with this year were compliance with work requirements, which is sort of assumed, baked into the targets in the global deal, as well as retroactive coverage. So when someone is deemed eligible for medical assistance, how far back do we look in terms of what claims will be covered by Medicaid? And so that is all sort of wrapped up in the numbers for the Health and Human Services Committee. And certainly it's not everything the way that the governor proposed it, but some of the sort of the finer points will be worked out by the committee. On the SNAP space, there is funding to help the state sort of backfill some of the lost federal funds because the federal government has cut what they're providing to support the administration of the program. There's also resources to help us improve our payment error rate so that we are less likely to need to spend as much on a new cost share for benefits in the future. The budget doesn't include funding for a new benefit cost share, which won't kick in until 2028 and 2029. So that's something that, as we learn more about our implementation of program improvements, that next year's legislature would have to grapple with. And if there are any questions about tax conformity, I'd let Commissioner Marquardt speak to those.
Well, they're still being worked. The question about the highlights of the bonding bill, I think people are still working. The biggest thing is that it's a robust bonding bill. I think we agreed on 1.2. Is that correct, Patrick? And that will be split with state access preservation, universities, things, the water treatment portions of that, the roads and bridges. I think a question that has come up and has been addressed about infrastructure and what does IT infrastructure look like? And I just want to say on this, I think it's worth giving a note of thanks to an outgoing legislator. Republican Representative Paul Torkelson is going to be leaving the legislature. Representative Torkelson has been an absolute champion on modernization of IT, especially for the counties. And this is a massive undertaking. It is going to be in the hundreds of millions of dollars stretched over several cycles. But in this session, led by Representative Torkelson's his vision on this, we were able to put a bunch of money in that outside of bonding. But I think this question has been breached, and I know it's a tough one. It's tough with the building trades who work so hard to make sure that bonding's in there. I think in a modern world, we do need to understand how do you afford legacy upgrades to technology that are going to, and the reason we advocated so hard, and I'm appreciative of the representative, we as an administration advocated so hard for it is, we believe that a big piece of this fraud detection lies in the infrastructure that is so outdated, and we hear that all the time from the counties. So at this point in time, we'll get that division. They're still working on what that will look like. There'll be local projects in there, but yeah, it's separate, the IT piece is. I bring it up in conjunction with that because I know it's been being talked about. I mentioned it here. It's controversial because it would pull money away from traditional infrastructure projects. But like I said, you don't get to come here and talk about you lowered taxes while the bridges are collapsing. You don't get to say you lowered taxes while water treatment plants aren't there. You don't get to say you lowered taxes, complain about fraud when we're using green screen computers that make it easier to do that. And I think this legislature, quite honestly, responded pretty well to that. I asked them, I said, if you're going to do a state IG, it needs to be funded. We figured out a way to do that. And so I think this bonding bill, again, these have been some of the most robust. It makes a big difference. I said long-term stability of the state in terms of physical infrastructure, budget stability, budget reserves, long-term outlet of job growth is very, very solid. And couple that now with the ability to have the tools to do a better job of stopping fraud, it puts us in a good position. I'm proud of this. I know there's a lot more work to be done. I hope we can tackle some of these outstanding issues, and I would just make my plug after coming with those kids upstairs. Just put that bill to a vote that passed the Senate. Let's see what happens up in the House. So we'll get back with you. Thank you.
Thank you.
Thank you, guys.
Commissioner, quick question. Repeat again where that $500 million reserve.
So it'll be the reserve. There'll be it becomes a secondary reserve, and there'll be a transfer from the budget reserve up to $500 million. There are also a couple of cancellations that are not canceling early, but upon their cancellation in 27 and 28 will cancel to that hospital reserve. From the budget reserve or cancellations.